The Ministry of Health on Tuesday resumed some services at the General Hospital, including visitation. Services were scaled down as a result of COVID-19 pandemic, but as of Tuesday, these restrictions were discontinued with some new guidelines. Acting Medical Director at Hospital Services, Dr. Taisha Donald, outlined the new guidelines to be followed when visiting the General Hospital.
We would now start by doing temperature checks for persons visiting. So persons visiting, they will be expected to cooperate with security and nursing because temperature checks would be done at the entrance. Two, you would see an increase in signage across the hospital. So during the course of this week, we would have more signs regarding hand hygiene, wearing of masks, maintaining social distance. So we would try and have an increase in the number of signage around the hospitals across Grenada to ensure that persons are reminded of what's expected of them. We also plan to do, we're trying to increase the number of sinks that are around. So apart from all the hand sanitizer pots that you would see on all the floors, we would also need to do some extra sinks, which is in progress, so that persons can wash hands or sanitize hands.
Dr. Donald explained the changes to be expected on the various wards.
It would be one visitor per patient at a given time. And all of this, of course, to avoid overcrowding on our wards. So we'd have 3 visitors per cubicle at a given time. In terms of the pediatric department, now because we're dealing with kids, children, normally on the pediatric department, we allow parents to visit their children. They spend the entire day, generally from 8 to 6. In this period, we're advising that one parent be allowed to spend time with their child at a given time. So if both parents want to spend time with their child, they would have to share the time. In terms of the labor and maternity ward, a person is allowed to labor with someone who is in labor, and they could stay throughout that process, the whole process of labor and delivery. And of course, the regular rule applies. The next of kin or the husband's immediate family could come and do drop-offs and so for that person on the ward following delivery. For intensive care units. Now, intensive care units, which are the areas where we house our very critically ill patients. Now, in those areas, generally it's a restricted area. However, in those areas, we would allow persons to, or family members, very close family members, to visit one person at a time.
Visiting hour is from 11 a.m. to 12:30 p.m. and 3 p.m. to 5:30 p.m. For outpatient clinics, appointment must be scheduled with an approximate half-hour estimate per patient. People will no longer be allowed to go early to clinic to wait their turn. Lab service continues with only 6 people allowed in the waiting area at a given time. X-ray and ultrasound services will be done by appointment. Oncology services continue. Clinic resume also this week, and surgeries are expected to resume within 2 weeks. Dr. Donald said that this week is considered a test period for the General Hospital, with plans to review the new measures next week. Cherry and Blackman Stephen, GBN News.